All right, here we go. Ladies and gentlemen, folks of all ages, it is PM. We're going to get started in 1 second here. All right, so I want to make sure that all my stuff is being recorded. I got all my mics and cameras working here. Let's see, we've got this. All right, awesome, awesome. And looks like this. All right, cool. So let's do this. Let's get started. It's a little bit past 1. All right, so I'm going to pull up my slides or pull up my camera here. Hello, everybody. How are you doing? Today is a sunny Tuesday in New Jersey, and I'm here. My name is Dr. Paul Kachoa, and I'm a physical therapist and owner of PAR5 Physical Therapy here in Randolph, New Jersey. And I've partnered with Better Spaces to bring health and happiness solution for today's hybrid workplace. Now, today's session is preventing knee injuries in skiing. Talk about proper form and strengthening tips. So the knee injuries, such as ACL tears, and if you stick around in a couple of weeks, I'm going to be covering more in-depth stuff about ACL tears. Knee injuries are very common in skiing due to the high impact and sudden changes of direction. So with this session, we're going to focus on some techniques and exercises to protect the knees, improving, including how to exercise and stretch and warm up properly. All right, so without further ado, let me pull up my slides here. Here we go. Preventing knee and injuries during skiing. All right, so because I am a medical professional, I have to put up this slide in every one of my talks because the stuff that we're going to be talking about today is general advice aimed at a broad population, a broad audience. If you're dealing with something specific, everybody's knee is different, everybody's body is a little different, make sure that you get a thorough physical exam and assessment so that you can find out what the root cause of your problems are so that you can enjoy life and be pain and injury free. All right, because the main thing is that we want to avoid injuries. We want to enjoy our day on the mountain and avoid knee injuries. Now, again, the knee is a very simple joint. All it does really is bend and straighten, bend and straighten. It's when we introduce rotational forces in that bending or straightening joint that things get bad. We can rupture ACLs, MCLs, all these ligaments. And also, even just like if it's your first time out, first time for the season, first runs, you might feel a little bit sore. So we want to be able to prep for that and find out why you feel so sore the first couple of days. All right, so these are some common causes of injuries or things that increase your injury risk, right? One, you don't want to ski alone. Just for a safety standpoint, we want to make sure that we have a partner to protect and watch out for us. And also, we want to wear the proper equipment. We want to wear warm clothing. Follow the rules and use proper techniques and be aware of the surroundings. Know your limits. Definitely warm up with exercise and drink plenty of water because even though it's cold, you will dehydrate and sweat, and that dehydration affects your ability to perform, your performance level, and also can increase your risk of injury. So components of a good winter sports workout kind of hit all of these boxes here. We're talking about endurance, stretching, strengthening, and balance. Now, when we're diving into like what exactly does that mean, we want to do some type of cardiovascular exercise or a high intensity interval training, hip stretching, knee and hip strengthening, and balance and proprioception. Now, proprioception is just a fancy term meaning joint sense, so that you know exactly what position your limb is in or your joint is in without looking at it. So that's proprioception. And that's important when you're focused on all the external environments, the slope, all the other skiers on the mountain, the terrain, and being sure of where your knee and foot are, where's your edge, those are things that you have to pay attention to, and that plays into balance and proprioception. So specifically, if we talk about HIIT or cardio, it's exercises that's very similar to the load cardiovascularly that skiing would put on your body. So if we think about the way it is, like the energy systems or the cardiovascular aerobic capacity of a marathon runner is a little bit different than someone who skis, because it's like an effort, you're working hard, and then you take a break. So that interval training helps. So working for 20 or 30 seconds of high intense workout exercise routine, and then taking 40 or 30 seconds of rest, that interval training really helps to build your aerobic capacity and muscular endurance so that you can perform better on the slope. Hip stretching. Oh, actually, let's talk about this. So these are the three energy systems. I touched on them a little bit earlier. Is that the anaerobic, alactic energy system is the first one that your body uses. It's the ATP CP energy system. It's for high intensity, short duration burst activities. There's no need for your body to use oxygen with this. It just uses your body's own storage of creatine phosphate as energy, and it usually is good enough for just 10 seconds. And then the next one is anaerobic and lactic. That's a glycolytic energy system. It's high to medium intensity. It lasts up to 90 seconds. So most sports and athletics use this system. This system also does not require oxygen to function. Waste products that are produced by the anaerobic lactic acid lactic system are lactic acids. They're the name, and they accumulate in the blood and in muscle cells. And that can contribute to the burning sensation in the muscles, maybe shortness of breath and fatigue. Those are all symptoms as your lactic acid level builds up. So focusing on training in that 90-second high intensity or exercise parameter helps this energy system so that you can reduce the amount of lactic acid that builds up and improve your lactic tolerance so that you prolong your ability to work at that level. All right. So, and then finally, we have the aerobic system. So this is the marathoner. It's low intensity, long duration. It's up to hours of energy. This is almost unlimited. It's really for slow activities, and this requires oxygen so that you inhale oxygen, exhale carbon dioxide. Oxygen is the aerobic system. All right, now diving in, hip stretching. We want to be able to make your hips as flexible as possible because they're the ones that really control rotation in the lower body. You have your boots on, which locks your ankles in a certain position. So we can't really use the mobility of the ankle to create rotation. We want to be able to have a good force of our leg into the edge of the ski. So we want to use the bigger muscles of your hips, and keeping them as flexible as possible is key. All right, and then knee and hip strengthening. So knee and hip strengthening is important. Specifically, we're going to talk about squats and progression out of squats, making things easy, and then progressing to more and more difficult exercises. And these are all done in standing and weight bearing. Exercise machines such as like seated knee extensions, where you're just sitting down and kicking the knee out, really doesn't apply to ski, because while it does strengthen your quad muscles, oftentimes I find with a lot of clients that come in to see me have overdeveloped quad muscles or tight quad muscles that create a lot of compression over the kneecap and the front part of the knee, and they wind up with knee pain because of the imbalance. Very strong quads and very weak hips. And then finally, we're going to cover balance and proprioception, single leg exercises, integrating balance with some of these strengthening techniques. All right, so let's dive into it here. Let me pull up my two-shot, and we're going to get into it. So you can see me in this camera, you can see me in that camera. So let's talk about the knee joint, how it functions. So again, like I said, the knee joint, very simple joint. All it does is straighten and bend, straighten and bend. And if we did it in a closed chain or a weight-bearing position, it's straightening and bending, straightening and bending. It doesn't like rotation. So the point that creates the most stress on the knee and the ligaments is if the knee goes in like this. Now, if I'm sitting, it's basically this position, internal rotation of the hip, or when the foot is flat, this valgus position where the knee kind of doesn't match up with the ankle and the hip. And that knee position is controlled by the hip muscles. So very simple exercise to kind of groove this position in, and joint sense or proprioception is a very simple sit to stand. So it's basically coming from a sitting position and then standing up. Oh, we got somebody in the waiting room. I'm just gonna let them in for a moment here. There you go. All right, admitting that person. All right. If we are doing a sit to stand, one of the key things that I see and the faults that I see is that when people stand up, their feet aren't flat and the knees buckle inward. All right. So think about like every time that you get up out of a chair or sit down on a couch or sit on the toilet, get up off on the toilet, those little incidences throughout the day, if that results, or if your knees go inward every time that you stand up and sit down, we're really kind of reinforcing that faulty movement pattern. And if we get into this position and we feel like, this is our default, especially for beginner skiers trying to turn those things and do the, pizza crust or pizza slice positioning of the skis, we're internally rotated. But if the hips are tight, they get this motion from the knees, and then the knees just buckle in, and there's no control or stability in the knee because the hips are too weak to control that position. So we want to make sure that we have enough strength and proprioception, joint sense, to know when our knee goes in, when it's in a bad position, and when it's a good position. So if we're doing this simple exercise, sit to stand, I want to make sure that my knees are over my toes. If I'm doing it in the mirror, you see in the camera here, there's my ankles, there's my knees. I want to keep my knees over my feet. If I'm out like this, most people will assume this really wide stance because they feel more stable and it's easier, then your knees have to go that wide. Oftentimes I see that people will go like this, really wide, and they start to stand, and again, there's that poor position, all right? So we want to make sure that's the most simplest way to introduce squatting. Now, if I take away the bench and I'm just going to do it freestanding, I'm going to put my hands out in front, keep them above my shoulder height, in the same position with my legs, and make sure that my knees do not go inward of my toes. All right, so here I am unsupported. There is no chair for me to squat to. I want to make sure that I have a good upright chest. My feet are flat, and I can drop my hips through that full range of motion, at the very least, the same height as the chair, if not lower. If I can get my hips below my knees, that's great. All right, so these are, again, generalizations aimed at a broad population. If you have issues with this or your knee hurts, please go have that checked out and assessed. Now, we can make this more difficult by taking away one leg. So if I take away one leg and I can't do it like single-legged and then just kind of come up and then down off of that single leg, I can touch this down and go lightly with the toe and then do the same thing. Now I've got the majority of my weight on my right leg, but I'm still going to maintain those good, proper body mechanics and knee alignment. I can do this, repeat this on the same thing on the other side. And then also without the chair. Okay, so I'm going to get up, make like a, I'll show you on this leg, like a kickstand, we call it, where this other leg isn't back here where I'm putting weight on it. I'm putting it really close to this other leg, and it's very light, maybe like 80 to 90% of my weight is going to be on my right leg right now. And this is just for balance. And I'm going to do the same thing, try and squat low, maintaining good knee alignment on my right leg and focus on that. Okay, so that's how we can compress that. And then I have this band set up. So this elastic band here, it's attached to my treadmill around knee height. And if I put this around my left leg like this, now the band is pulling my knee inward. So you could probably see in the mirror maybe that band is situated this way. And now from the camera, this camera angle, you see it from the side view, that if I squat down, this knee wants to go in because of the band pull. And I want to make sure that this gives me more joint proprioception feedback of where I want this knee to go with my double leg squat, normal squat, or that kickstand squat, where that knee wants to go in, but I want to make sure that I can protect that, okay? Because let me just wrap it around here so you can see from the front with this main camera. This band wants to pull my knee in this way. And again, inherently, it's not bad. I'm going to tell you a secret. It's not inherently bad that your knee goes into this position, but you need to be able to be strong and control that position. Oftentimes, you'll see people collapse in that position and then can't control it. And if you can't control that position, then that's when we run into injuries. So this, depending upon how tight you can make it, it's pulling me in, and I have to fight that as I go into my squat or my kickstand squat. I got to fight that motion. And you can add as much tension as you feel comfortable, but the technique and the body mechanics need to be spot on, all right? Because this really, if I even just sit into this position or even just get into like a skiing position, I see, all right, this is where I'm going to be with my skiing. I need to be able to control that side to side. Now, that's a resistance. If you want to build in some balance, I've got this half foam roll. So you can probably see how that's set up. It's like a 3-foot foam roll, but they cut it in half. It's a half foam roll. You can get these online or any sporting goods store. And then you could do everything that we just did and add a little bit of a balance component to it, right? So here I am squatting on these things, and they're round, so it challenges my hip and my ankle and my knee position, and I could do my squat. I could stay in this position, hold this for a recommended amount of time, how long you're going to be in that turn, and try and do it single-legged. So I've got toe touch on one leg, full weight bearing on the other, and then I could, again, do the same things that we talked about, getting into a squat, maintaining good knee position, activating that hip, and then trying to balance on that edge or on that foot. To make this more intense or more challenging, I could turn these half foam rolls over. So now the flat side is up, and everything becomes even more challenging because of that balance. Now the ankle is going to play a role into it. Now, I can imagine if if you did this in ski boots or if your ankle was locked up, this would all be controlled at the hip. Again, if I put weight on my left leg here and I'm on this half foam roll on my left leg, you know, my body has to figure out how do I maintain balance over that foam roll. And I could do the same thing, kickstand squats or double-legged squat down here. It's a little bit easier because I've got the support of both legs. But if I do this in a kickstand position, I have to be really conscious about how do I control this knee and get into a position where I can get onto an edge and then lean into it and still control that knee position, all right, from the hip. Okay, so those are a couple of things to think about when you're strengthening your hip and controlling your ankle or controlling your knee to avoid injury. Again, to review, we don't want this position. We want to be able to kind of maintain a good alignment of the knee over the foot and ankle. And that motion, that position is controlled at the hip. The hip muscles, glute medius, the piriformis, glute maximus, they do all this external rotation, and strong glute medius, especially the glute medius, helps to control that valgus position or that knee inward position to prevent that strain going directly into the ligaments of your knee. So the stronger the hip is, the more you can control this position and prevent the strain going onto the knee and be strong to get into the opposite way. Alrighty, so I think that's all we've got for this class. Let me pull up the chat, make sure if we have any questions, we answer them all. Let's see. All right, so I think I've got everything. Hip stretches. So you know what? Let's talk about that. I think I missed that. So hip stretches. The glute medius, again, externally rotates. Pretty simple to kind of get into a stretch position. So easy sitting. You could do the cross-legged version, right? So I'm just crossing my leg up like this. Now, the muscles are connected to the pelvis. So my pelvis and my back, which is connected to my pelvis, that has to be in a certain position. I can't get into this position and be rounded. All right, so let me show you from the side view here. If I'm doing my left leg and I round out and go down like this, I'm not going to get much of a hip stretch. I'm going to be searching for the stretch. But if I stabilize all the attachment points of this muscle, so like a rubber band, I can pull it apart, I can get an effective stretch. So as I sit up tall, I keep my back straight. My tailbone, my pelvis is kind of tilted forward like this, and my tailbone's kind of sticking out. That position locks up the pelvis, locks up my back, and locks up the attachment point of that glute. And if I just shift my shoulders forward, I can get that stretch into the glute much earlier than if I was just kind of like rounding and going down. So I want to be tall and then just create that hip stretch. All right, so that's one super easy stretch. You can do hugging your knee into your chest, which is more for the glute. And if you want to get down on the floor, you can do some hip stretches like this, hip up in front or across the body. Because the hip is a three-dimensional ball and socket joint, you have to do all these different angles to stretch out the hip fully. And then we have the internal rotation stretch. Because this is a little bit tricky. You have to have your foot as far out to the side as possible before you rotate that foot in. And then maybe if you need extra force or extra stretch, you push your knee down. So all those stretches you want to hold for at least 30 seconds. 30 seconds is a recommended time for any stretches to become effective. So that's kind of that's going to be our list of stretches for the hip. All righty. So let's see. Any more questions? We're good. All right. Well, folks, it's 1:23. So thank you for joining me today. You can look for this session and many more on demand on any of the Better Spaces apps. So I'll be back Tuesday, January 7th next year, and we're going to talk about more preventing ACL injuries in young athletes. So we're going to learn more about the anatomy of the ACL, the anterior cruciate ligament, common causes of ACL injuries in young athletes, and preventative measures such as strength training and proper technique. All right, so everything is going to be good for the knee. We're just going to be diving into more ACL and knee protection next session, January 7th. If you have any questions, feel free to email me at paul@par5pt.com or team@betterspaces.com. All right, thank you for coming and be well.